Stephanie here with Dr. Nikko, and we were just asked a question by one of our followers. Dr. Nikko, is a BBL or Brazilian butt lift permanent?
Great question. So when we do the liposuction, we're removing all the stubborn fat in your waistline, except for the subcutaneous layer, of course. Now, once that fat is removed, it is permanently gone. You don't make more fat cells. You're born with a certain number, and when we remove from that area, it will be gone forever. Now, if you gain weight, you will gain it in other areas. That's why you gotta take care of yourself. So in a sense, the contouring that we do is permanent because that fat's removed. But you can gain it in other areas if you don't take care of yourself. Now, what about the fat that's injected? Is that permanent? Another great question. Fat grafting is really considered long-term. Now, I don't call anything really permanent because we all age and we lose fat cells, we lose collagen, we lose laxative fiber.
Gravity.
Right. So nothing is permanent, but it's definitely very long-term. Once that fat is injected, and we're talking about very stubborn fat that people can't lose.
This area right here, the whole flank area.
Right.
That's the hardest part, and that's
Exactly.
the fat we're injecting.
Yeah, and so when you inject it, it stays around. Now, people will say, well, I heard that only 50% survive, only 60%. What's that about? Well, it depends on the technique, right? So if you take 300 cc's of fat and you don't spin it down, half of it may be tumescent fluid still. So when you inject it, patient will look great. And I see a lot of these wonderful, wonderful pictures from physicians, and it's like right after surgery. Well, after surgery, there's so much tumescent in there. They're on the OR, they're right there, and they look fantastic. I don't really like to show those pictures because it just sets up for a disaster. Because patients are expecting, I'm gonna get that kind of result, and when they don't, they get disappointed. And so you definitely wanna avoid that. So if you spin down the fat, then a lot of tumescent is gone. Then really 90% of the fat cell will stay. But if you don't spin down the fat, a lot of it is tumescent, and that will be absorbed. And then you don't see as much as you did after surgery, and then patients will get disappointed.
Correct.
So it depends on the technique.
Well, there's another term that we like to use in our office, and the fat is called...
Oh, the fat is called...
liquid gold.
Liquid gold, thank you.
It is.
Why is it liquid gold? Because fat cells have so much stem cells. Stem cells will help your skin look better. It'll help not just give you volume, but stem cell will help the muscle, the gluteus muscle, just really just fine tune itself. And so stem cell is fantastic, and that's the reason why we call fat liquid gold.
There you go. All right. Well, thank you, Dr. Nikko. That's all really great information. If you want more information, you can call our office, 713-960-1311, or you can go to our website, drnikko.com.